Hello and welcome to our interview today. I'm very glad to have here my dear colleague, Dr. Twara Ashish. And we are going to talk about the understanding how diseases develop today. And dear Twara, would you please introduce yourself to our listeners?
I am basically a homeopath based in Ahmedabad, India, and I practice classical homeopathy following all the principles, never letting go of any. And it has been more than 10 plus years since I'm practicing.
How did you meet homeopathy?
How did I meet homeopathy? I met homeopathy when I went through Organon. The initial experience was quite bad when I was in my puberty, when I got to know there is something like homeopathy in this world. And then when it was time to enter the graduation school, it was very clear I wanted to be a doctor. And I'll tell you frankly, I was not opting for homeopathy. I wanted to be an MBBS, as all of us here want to be. But some role destiny has played because I got some lesser marks. And then I said, what will I do? I'll leave and I'll give again the entrance test for MBBS next year. But then one of my well-wishers said, why don't you join homeopathy instead of wasting 6 months? You join, the syllabus is the same. You'll learn anatomy there, you'll learn anatomy here. Physiology you'll learn there, you'll learn here. So don't waste your 6 months.
Yeah.
And I said, okay, I joined. And then I remember this day when Organon lecture was there, and that was it. It was like, this is my cup of tea. It was like falling off apple to the Newton, and it was homeopathy and me. So it was like that. And then I never looked back because whatever medicine relates to was there.
Mm-hmm.
And apart from that, the philosophy and materia medica of homeopathy, it was like, it went on involving me to such an extent that by the time I completed my internship and everything, I was like, now I want to try this.
Yes.
And it's obvious, we say in our culture that our gurus, the teachers, they know us better than we know ourselves. So I asked my Organon professor, I said, sir, what do you suggest? Should I work under some senior homeopath and then self-start myself? Then he said, I don't think so. You go to your hometown, start practicing. And I followed it. I started practicing. I was as skeptical about getting results as anybody else would be. But as soon as I started practicing, I started to see wonderful results. As it was, we study in the books, the same way the results appeared. And then it was like, wow, this is something which I've seen cases from, a fish thorn stuck in the throat to deepest of disorders, to autoimmune disorders, palmoplantar psoriasis, many. But as it is said that you do not go by the name of the disease in homeopathy. You understand the individual. And I give enough time to my patients. It is till I feel that, okay, this is it. And often my patients tell that, like, now I have nothing more to say. I've told you everything, doctor. That is the beauty of homeopathy. Now, if we come back to diseases, our topic today. Disease, as homeopathy has stated, that disease is a dynamic process. And fortunately for us, Mary, I will share this with you, that recently, in past 3 decades, that is around 30 years, we are seeing that science has also started to understand that by way of reductionism, separating the part from the whole, you cannot understand the process.
No.
Because disease is not just, your nose is suffering or your leg is suffering. No, it is the whole of you which is suffering. But as we know, it is thrown to the least important layer of your body as per the individual. Now, when we understand this, how I can tell you that science has started to understand this? Because in past 3 decades, there are many researches which show how our immune system is affected by our emotions. You know, earlier there was psychology, endocrinology, neurology, immunology, but now it is known as PNI, psycho, neuro, immuno, and endo is taken under immunology. So they have understood that if you want to understand a disease process, see, disease is not just you getting exposed to an organism and coming down with disease. It is a process. When I say, yeah, it is a process. When I say process, I would like to give you an example of the current scenario itself. When SARS-CoV-2 started, COVID-19, in the initial phases, whatever symptoms were collected by our fellow friends, they pointed towards respiratory disorders. And as now a time has passed where we have seen so many people getting affected by the same disease, the same organism rather, instead of calling disease, I would call it the same organism. We see different kinds of presentations. We had some presentations from Italy where they said that it was cardiovascular. Then the people who observed, they found COVID toes in children, which is a cutaneous where your skin is affected. Then there is pink eyes, and even a lot of people are asymptomatic. When you test them, they are positive. When you test them back after the duration of the complaint, the phase of the disease, they are all clear. But the whole phase that they pass is asymptomatic, without any symptoms. Yeah. So this brings us to the point that disease is not something from outside. It is basically the interaction between the organism or our surroundings and us as human beings. It is a process. And now when science has understood this process, we are seeing that it is compared to the mathematical part. Because to understand life or biology, life rather I would say, to understand life, you cannot divide it into chemistry, biology, physics. That is not possible. Because the word health itself means related to whole.
Yeah.
So life is also whole. We all are, living processes. There is so much processes going within us, we don't even know. If we have to tell, for example, if we have to tell that, if we have to tell our heart, beat, breathe, beat, breathe, we will not be able to do anything. All this goes without us realizing that we are a complex process. And now this theory of complexity, along with nonlinear dynamics, has entered. This entered quite back when DNA was, when the structure of DNA was found out, because it was purposefully mathematics. It is known as cybernetics. The cybernetics was pushed into biology to come up with the double helical structure of DNA. Okay. So now finally, we are in a good moment of time, because when the psychoneuroimmunoendocrinology has started, that means science has opened one eye to understand that disease is a dynamic process, which we as homeopaths, Master Hahnemann has told us since about 200 years ago, more than that. So it's good. But now the question they will face is how to treat this, or how to deal with this dynamic disease process. The good thing is we already have answers with us, but it is time that with open-mindedness, as science normally is open-minded, unless some people have some reasons. So this is how the disease process is. Now, there is one more example I would like to give in here to understand that how each individual is different. Say, when 10 friends go together out in an environment. Okay. Now what happens is, when they are in the environment, suppose, suddenly there is atmospheric change. And some who are perceptible, who are sensitive, they'll start getting symptoms of rheumatism. Before even the thunder and lightning and rain has happened. Okay, they'll feel something is not all right. Why this joint is paining? Rest of them, suppose, went further. They got wet in the rain. Not everybody will develop symptoms. Some will be completely fine. They enjoy rain like it is blessing. Rain is actually going on. So I could actually correlate it with the present day. And some you will see will come up with, say, allergic rhinitis, just the watering of the nose and that's it. Somebody will come up with sore throat, and somebody will directly get asthmatic attack.
Yeah, can happen.
Yeah. This brings me to what I want to state, that this is why we are known as complex systems. Because first thing, we are open. We are exchanging with our environment continuously, whether we are breathing, speaking, eating, or excreting, right? We are an open system where matter and energy continuously goes in and comes out. So to maintain balance in such a system is not an easy thing. We are always on the go. We never know what will tip us off, right? But then there are many factors to this. The first thing is how healthy we are, what state of mind we are, because recent studies have also found out that those people who are in stress, they are more prone to inflammations.
Definitely.
Yes. And within that phase, if you take that stress away and after 10 minutes you take their blood samples, you will find that they have come down to normal. It makes them prone to inflammations and many other disorders. So this is how we understand the importance of our psyche, our thought process, our emotions. And in homeopathy, we well know how emotions affect, how emotions can create lots of disorders, right? And apart from this psychology, the health also comes in the balance within our body, which is going on. Now, when disease happens, it is not sudden. It is because there is something within us which is already out of balance. Like we understand that if we plant a soil, if we plant a seed of a plant which is usually grown in tropics, into the snowy areas of Canada or USA, it will not grow that well. So the soil, the host part, is equally important as is the disease producing organism or disturbance, whatever we may see it as. So when this host part is in disturbance, the organisms get a chance to produce the disease. And sometimes I've seen people nowadays, they are very anxious. A little thing happen and they are anxious. They'll run to the doctor. You have to understand that when there are any signs or symptoms, not always is you need the help. See, suppose you ate something which was not good and you got diarrhea. Your body is getting rid of the toxins. It will stop. The moment it gets rid of the toxins, you are done. Maybe overnight, next day you'll be all good. You will need replenishing your balance, chemical balance. That's it. But with anxiety, itself produces more diseases. Okay. We see people, when we take histories, this is a wonderful thing when we take histories, and when the more older the patient is, the more lengthier the history goes.
Yeah.
And we go through the life space of the patient, wherein we get to see how the disease process has developed and where was the beginning of this disturbance. Sometimes, if, for example, a patient of psoriasis has come up, psoriasis, as we all know, is an autoimmune disorder. So psoriasis, as we know, is an autoimmune disorder affecting so many of our systems. But when we take the history of the patient, we find what was there before this psoriasis.
Yeah.
Say the patient had some gastric complaints, which patient got some medications here and there. And then we still go deeper. And sometimes we find that the psoriasis came up from a simple thing, a simple emotion which was not addressed. An emotion like grief. Okay. Say a patient lost a very close, near and dear one. But natural. All of us feel grief. right? When we lose someone close. But then there is a phase. Then when we, come out of that grief and start living, we accept that this has happened. What has happened has happened. But many patients, because of their nature, they are not able to accept it. They are not able to move on. They get stuck in that place of time. Life moves on, years have passed, but they are still stuck in that emotional state of grief. When we see this, normally as homeopaths, we do very less counseling because we let the light come from within of the patient. We would select the appropriate medicine, which we will give, and we will tell the patient that when you will start to see improvement, your old symptoms will reappear. Sometimes patients think what doctor is telling. How would the old symptom reappear? But it happens. And when the patient reaches that state in the line of treatment and those old symptoms reappear, and then he comes and says, this has happened. We have to be equally, remember and go through the notes and see that, is this your old symptom? Some will say yes, some will say, no, doctor, never this happened to me. And then slowly they will tell, but it was there once and it happened. We can correlate, we can understand how it is happening. We tell them, nothing to worry, no medication for this. Why? Because the disturbance is coming out. We are throwing the disease. So don't try to do anything. The symptoms will pass by itself. It will not be in that intensity as you had suffered in the earlier phase. It will be lesser in intensity, shorter duration, but it will pass. And then when this happens, and then after that comes the grief state. The patient has to pass through that grief phase as well before coming out of that state, before coming out of that disequilibrium, which is created in the psyche by that one event. So this is how it all works. But to understand this, as I've said, that we are complex systems, we continuously exchange energy, right? And it is good to know that now this complex system with, pardon me with all these words because I may be sounding too scientific, but what I wanted to do today was I wanted to put facts. I wanted to, bring that where we are. This is actually very good for us because when somebody is coming in our line, it is easy with open mind when they are coming. And when we are also open-minded, it is easy to collaborate and come to a place which is better for whole humanity. There are cases like, say, mechanical injuries or accidental cases where we need intervention. No one can deny that. No homeopath would tell that it is a road accident, I'll give homeopathic medicines. It is silly to say so. You have to understand your scopes and limitations. Yes, and when we know this, we know how to handle. And in fact, now even there are studies where they are seeing that how people are reacting. In India, as we know, the concept of holism is woven in our culture. We see everything as, you are a whole body, a whole family, a whole earth, where we see, we say Vasudhaiva Kutumbakam, the whole world is one family. We see it as that. And even beyond that, we see the universe as one whole thing. So in India, for patients to understand the concept of holism is very easy because they are raised with that. They understand holism. And that's why when such statistical studies are done, that how is the response of people in understanding or accepting integrative medicine, wherein you have a hospital, you have a department of homeopathy, and wherever whatever science is good for patient is given to the patient. Okay, and it has seen that almost 70 to 80% patients want this kind of system.
Wow. So in India, 70 to 80% want to be treated by homeopathy.
not just homeopathy, they want that integrative approach.
They want the integrative approach.
Yes, yes. And yes, as far as treatment is concerned, it would be more than 80% because in India, people are more conservative minded. So their first approach would be how we can avoid surgery.
Mm-hmm.
Right? They will not easily go for surgery. So even the doctors, even the allopathic physicians, they also will start the conservative line first. Then they will tell, now there is nothing, you have to go for surgery. The patient will not go back. Patient will go and find somewhere somebody. He will come to the homeopath or the Ayurvedic physician and he will go and ask, can you do anything in this? He will bring his big file with all the reports. And he will tell, I don't want to go for surgery. Is it possible to treat this? And wherever it is possible, we will tell, yes, we can, or you can have this much time period. If you improve in that time period, you will not need surgery, depending on the case.
Mm-hmm.
Most cases, they don't need to go for surgery. Such cases would be like renal stones.
Yeah.
Yeah, where they don't want to go for that surgery, or even uterine fibroids, where female don't want to go for surgery. They understand that if something is possible without going under the knife, it is more better.
The knife
is
is
more
always the last resort.
Yes, yes. And that is how homeopathy through years, has gained so much of importance in India. It is like, as they say, that homeopathy is the adopted child of India.
Mm-hmm.
Because it was regularized in 1973 by the law.
1973?
Yes, the first law of Central Council of Homeopathy.
Wow.
And then it is amended every period of time as and when required. And since 1973, there were first diploma holders, then there were graduates, degree holders, and then even MD masters have started in various subjects across India. As per your choice of subject, you will find a place. If you want to go, you can go.
Mm-hmm.
If you don't want to go, you do what you are doing. So that is how, the homeopathic scenario is in India. And because of the colleges, we have hospitals which are attached to the homeopathic colleges, and we have our conventional friends coming to teach us their subjects because they are best at it. Who could teach us best their subjects than themselves? So they come, and wherever there is human interaction, always there is chance of a window to open up. In fact, there are cases where we see that the family member of allopathic physicians would insist, you take me for my rheumatoid arthritis to a homeopath.
Isn't that interesting?
Yes, it is interesting. And very skeptically they will bring. And when they see the results, they say that even we could have not imagined what has happened, the cure that has happened by the law of Similia.
Mm-hmm.
And now it has started that allopathic physicians wants to be homeopaths in India. This is the new trend. Because see, when you are an open-minded scientific mind, when you have, you will realize where you can help. You will realize the limitation of your system also. Giving fluconazole or antifungals or say antibiotics, the first generation to even sixth generation we have crossed now. We see how it is. And if you are conscientious enough as a human being and as a physician added on top of the humanity, you will see what you are able to do and what you are not able to do. And when you are presented with something which is more better, why will you not choose it? Better for humanity. It's not about you or, in fact, our professor of gynecology used to say that the pregnant women who come to me and have morning sickness, I'll tell them, go take homeopathy. Why? It not only takes care of your symptoms, but as we see that homeopathy on a longer duration, or the patients who have taken homeopathy, their quality of life improves, their immunity improves.
Yeah.
If we see a case, a person who is periodically every spring suffering from an X disease, say suppose, and undergoes homeopathic treatment, he is free of the disease. The rest of the springs will be without symptoms. Who would not like it? You tell me.
Oh, everybody likes it.
Yes.
Yes.
The thing is that you have to find when it is, or rather, as I say, when it is time for the patient. I'll tell this from my experience. When it is time for the patient to be cured, the patient will reach you. Even if the patient is of your family members or your close relatives or a very well acquaintance. And you would have often told him, why don't you try homeopathy? But when the time comes for him, he will come. He will say, I want to do homeopathy now. And then he is better. So it is such a wonderful science that if, it is applied in a proper way across the world, a lot of suffering of humanity can be reduced. A lot of suffering.
Absolutely. As I said, my life was saved many times by homeopathy. I wouldn't be here without. And I'm very grateful for that.
We all are.
It's not only that we sometimes need surgery to be saved after an accident. Sometimes only homeopathy can save.
It depends on how much the injury is. Because it happens that even after fracture, or say, there are chronic effects of accidental injuries which are well taken care of. And we have our first aid box also. From this, what you have said, I remember the case of in my initial days of practice. Being a small town where I used to practice, my hometown. One day a chef came, and he had a deep cut with that chef's knife. It was as good as you would require 2 to 3 stitches. And all I did was, because crosspathy is not allowed and you should not do also. So what I did was, I gave him internally calendula. I dressed his thumb and I said, you don't open this for 2 days. Don't get it wet. Take your medicine. After 2 days, you come back and I'll see. And for 2 days, I also was like, I don't know, it was that deep. What would have happened? I don't know. 2 days, I was restless. The patient may or may not be restless, but I was restless for 2 days. And then the third day morning when he came and he said, "Ho gaya, it's done." So I was like, good. This proves that even the deepest of injuries can be taken care. Similarly, I remember that fish thorn incident. It was quite in the evening, and Saturday, Sundays, most doctors are closed. Yeah. And even the government hospitals are closed. You don't find doctors on Saturday, Sundays. And this lady came. She said, my girl has eaten a fish and the thorn has gone inside. She brought her also. I examined. I could see with the light that, okay, it was there. I was like, I don't know. Our books say, Silesia is surgeon's knife. But I never experienced this. And the time was such, patient couldn't go anywhere. I cannot keep the patient in pain for the whole night. What I should do? I followed the principles. I gave the dosage. I told, if you are better, or tomorrow morning you go and check what happened. Next day morning she came. She said, it's all better. You examine. And I examined. There was no thorn. And I was like, in one night, in one dose. Wow. being just, you have just completed your graduation and you are sitting in your own private practice and you are wondering and you are telling patients what is homeopathy, why you should use it, how good it can do to you. And when you get through such experiences, which are sudden, unexpected, and are thrown at you because of the situation, and when you get through them, it not only increases your confidence, but you start to wonder that the people who has developed, Master Hahnemann, who has developed this, his disciples who have added everything, how precisely the observations were done, how precisely the provings were done, the provers, how precisely they wrote everything. There are times when, we feel like the cases from the book we are reading.
Yeah.
That clear presentation. Yeah, that clear presentation completely feels like, did the patient read the book or what? But no, it happens. It tells us that how observation of our surroundings, changes so much. It affects so much on our perception. And when you take homeopathy, as an integral part of your life, you become a different person.
Yeah.
Everything that you see, you start to observe, be it the minutest thing or to the largest thing. You start to wonder how this is happening, why this is happening. To that state that, when a person is passing by from the road and you are looking at the person walking and going, his physical stature and everything, you will think, someday this patient comes, maybe he will be of Y remedy. And then it happens after a period of time, due to some XYZ complaint, the patient comes. But remember, Master Hahnemann has said to be unprejudiced. So we will not take that thought that, we thought he is this, we will give him this. No. We will go through the whole process as unbiased as we should be. We will analyze the possibilities. And sometimes, in fact, most of the times it happens that you realize that he fits into that remedy which you were thinking about him. You had just seen him, but he fits into it. And this is the beauty of homeopathy. That the law of similia, there is also some confusion about law of similia. Let me bring that point also. People think that law of similia is same cure same, which is not true.
No.
Yes, it is similar in nature, different in origin. Okay, like say when we give stramonium in a healthy individual and whatever symptoms we receive, such kind of symptoms when we see in a patient who is affected by his disorder, when that symptoms match, we will give that remedy. It is not that that remedy has caused the symptoms in the diseased person. That is totally wrong. This many times happens because when we write like cures like, people understand that is like poison cures poison. It is not like that. It is two different substances, but their result is the same. The process is the same. The end product, the end of the process that we perceive is same. When that matches, we go.
This is easy explained in German language, where the words, we have different words for that.
Yes.
It's easier.
Yeah. But English, there are many.
There has a little problem.
Yeah.
How is it in the Indian language?
In the Indian language, I couldn't tell you because, I'm a convent student. I went through English.
Okay.
It's all English. But yes, when we understand the depth of words, each word of English, like we say anger or irritability, we understand the intensity of both. Both are very near. I'm angry, I'm irritable. But you have to understand, irritable is just chirchidapan as we call it. And angry is angry. So when you understand that, it becomes easy because your patients are going to talk in the Indian language. So it is like you are understanding the Indian language, you are understanding the meaning of it and correlating it with the English words of your materia medica. But for patients, still I will tell you one more thing. What I find easy to treat foreign patients than Indian patients. Because my initial practice was in Div, which is a tourist place.
Yeah.
I often used to get lots of tourists, and some of them also used to get surprised, like, homeopath in such a small place. And I said, yes, why not? And the beauty is in giving the history. There is that openness. They will speak whatever it is. In our culture, people will, that woman can go and talk to her neighbor everything in detail, but to the doctor, she will not tell everything in detail.
Okay. Yes.
It comes that, it is easy for her to talk to the neighbor where she everyday chit chat is. But to the doctor, she would be like, how the doctor will do it? How the doctor will understand? In the initial days, they used to come and ask me, are you married? I said, why? Why you want to know I'm married or not? So, no, there are some things which only married women know. And I used to tell, we are doctors, we study everything, we know everything. Whatever it is, you tell me your complaint, I will find your solution. You don't worry whether I am married or not. It should not be your concern. Your concern should be your complaint. So, such experiences you have where how people have their mindset in society, you get to learn. And then you get to, accordingly guide them. That as per that, how you should guide them. Because everybody is brought up in a different society. They have different backgrounds. Some are very open, some are very shy. Some want to tell, but the society doesn't allow them to tell. It is not considered good. And some are very strict. Or some people who understand that, like when you meet somebody new, it should be formal unless you form a rapport and then you can be like, hi. Till then it is good morning, good evening. All cultures also affect a lot. And being a homeopath, when you come across cultures, you actually get to know what is common and what is uncommon. An American girl coming and telling, I had 5 boyfriends, I slept with them. This is very common for her. But if an Indian girl comes and tells this, the medicine will change.
Yeah,
because in Indian culture, it is not that openly people will not tell such things. I don't say they don't do. With the modernization and everything is there. But telling is different. So when we are exposed, so we keep on going through everything, so many things, because all these things affect our psyche, define what is normal for one individual, which is not normal for another individual. And holism is the concept of homeopathy, where you consider the patient as a whole. And when you consider the patient as a whole, you have to consider the environment, the community, what has put those things into that patient. Then you know if that is normal to do this or it is not normal.
Yes, and that is definitely different for India, for Japan, for Germany.
Yes, every country.
It's totally different.
Yeah.
I remember a colleague of us, Rosina Sonnenschmidt, telling me about what you can ask in Japan and what you can't ask.
Because it may happen if we don't know and we ask, the patient may feel offended. Patient will feel.
Definitely.
I have read about Japan, the culture of Japan, very little bit, not much, but where we see that it is close bound communities. The kids of 5, they walk themselves to the school. They travel on their own because it's comparatively safe. It is like everyone knows everyone. That reminds me of small towns in India where, everyone knows everyone. Through generations, they know each other. So it's quite safe. You can walk in. Even if you are 5, there is nothing to worry. You can go, you can come. It's very close, rather I would say, very resembling to the older times of India, where, the communities are tightly closed, where you always get to listen or get knowledge from your elders. Yes. Nowadays, because of so many things, we get to know so much things about everything, like how kids are raised in Japan, or how, you know, how parenting is done in India, where instead of showing superhero cartoons or Tom and Jerry cartoons, they are taught the stories or the cartoons of olden scriptures of God, where they understand. It's not just cartoon, it is with the moral imbibed in it, which is there through generations. All these things also matter a lot in the formation of an individual. And if as a homeopath we are not aware of that thing, we may miss out.
Yeah.
Yeah, because we rely on uncommon, PQRS. If we don't know what is common, how can we know something which is uncommon? So it is really important as a homeopath, that you are always, it's like you are a student for a lifetime and is good. Because learning should never end. Learning should never end.
Yeah, it's a lifetime and beyond.
Yeah. If you believe in beyond, I would not say beyond, because some believe, some do not believe. But in India, we do believe. We believe in the spirits. We believe that there is a life beyond life, because it is very closer to vital force where it comes like that.
Yes, I actually have been dead and came back, so I know there's life beyond.
Yeah. Yes.
And
But the concept is again the same, holism. Not just looking to your body, to the systems within, to the energy within, which flows, which balances everything. Yes. If you have been there, you will definitely would have known how different it is from the rest of the world.
it's absolutely different. When you first time see your body sitting there, it's an interesting experience. First thing I thought is, oh my God, this is no good sign, being outside of the body and seeing the body being collapsed. Yeah, it was an interesting time.
Yeah. Science will reach one day there also, no worries. Because recently, what we generally have in our culture, where women fast for a few days, people fast for a few days. All the studies have proved that intermittent fasting keeps you good, keeps you healthy.
Yeah.
It's like upgradation of the same old thing, which has been given us passed through generations, but now we view it in a new light.
Mm-hmm. It's history reinvented.
Yeah.
What I wanted to ask you is, did you ever have a client who had first skin disease and then got treated by an allopath, and later on came with asthma and autoimmune disease and went back through that scenery by homeopathy?
Yeah, there was a case where the autoimmune disorder was palmoplantar psoriasis, which used to come every winter. But before this, the patient had an emotional disturbance, and after that, there was some kind of skin eruption, which patient is not able to tell us, nor has any reports. And after that, was not actually asthma, but yes, some internal disturbance was there. After which this palmoplantar psoriasis had settled. It was like 20 years since the patient was suffering from palmoplantar psoriasis. So even patient couldn't relate much to how it started. But taking the history, we could find out that, okay, it was this one particular emotion after which how the disease has progressed. And then constitutional medicine was given in LM potency. I do use LM potencies often in my cases. And the treatment continued of course, we don't give the doses very frequently, but we do have to give something.
Yeah.
So the treatment continued for 20 months. And after 20 months, there was no recurrence of psoriasis in winters. It used to happen in palms and soles, which used to crack, bleed, scale, and really irritate patient, and patient used to feel like, I'll rather die rather than suffer this.
Yes, I imagine.
Yeah. And then when it does not happen, the patient came, because after 20 months was all done, then patient came and said, this winter I did not have. And I said, good, let's wait for another winter. Let's see what happens. Because unless you pass few winters, I will not tell you that you are cured. I have stopped the medicine, but you have to pass through that phase to see that you are not, the disturbance has gone completely. Like that, around, it's more than 5 years now. In fact, now I am no more in the contact with the patient also. But till I was there in my hometown, the patient had no complaints. We often used to cross each other, and the patient used to say, I am all good. And I say, good for you and good for me also. Because I, I don't like, when something keeps on and on and on, and then when somebody asks me, how is homeopathy? It is very slow. I said, yeah, it is really slow. A patient suffering from 20 years got cured in 20 months. That is less than 2 years. It is so slow. And then they would understand that I'm actually joking and telling that it is not slow. In acute diseases, we see how rapidly it comes. And in chronic, say, where is 20 years of suffering each year? And consider 2 years, within 2 years, if that is cured, that is quite
This is quick.
rapid. It is quite rapid.
Yeah. I remember some part I did read, I don't know in which book, there was told if somebody goes in the direction of a disease for years, if you're good in curing, it's the same way in months back.
Yes, it is known as Herring's law of cure.
Yeah.
Where it is usually also used, but it is very aptly said that how will you know? You are going through the patients, you are giving them the medicines, you are seeing improvement. But how will you be sure that the improvement is in the same in the direction of cure and not in the reverse? How will you know that you are going in the proper direction? There it helps us that in most of the cases, and we see this in practice, in most of the cases, old symptoms reappear. Even as old as the childhood symptoms will reappear when you are treated properly. Even the point where the complaints actually started from, that point will reappear. In between also everything, sometimes, some cases, everything reappears in a proper pattern, and in some cases, only some patches in between we see, which reappear and go. So it emphasizes us that, okay, we are going in the right direction. Otherwise we will be clueless to, whether cure is happening or not, because this presenting complaint has gone. But what about cure? I mean, we have to know, because we know how humans are in layers. How, I often give this example that you are like a pond or water, and the disturbance is like a stone, or say something from inside. And you see the ripples, the pond throws the ripples outwards towards the edges. So whenever there is disturbance because of internal or external, whatever communication of energy, your body throws that disturbance outwards. And it should never be brought back inside. It throws as much outward as its capacity is. If you are good in your health, you will directly see a red rash on your feet, not on your head, on your feet. Or you will come with hair fall or hair loss. Your health is good, you are losing hair, doesn't matter, you get bald, no worries, you are not dying. But if you do something on that rash, which is not in proper direction, and it goes inside, next it will find out which is the weak system. For somebody it will be liver, for somebody it will be bones, for somebody it will be blood, and then it will go there and settle itself there. Unless again you push it. Either you push it outward or inward. Mostly you push it inward only, so it goes more inward, then it gets more deeper, then it affects directly the essence, your immunity which protects you, it goes and directly goes there. Nothing can be done. Then, everywhere, from everywhere you will go, you'll come. There is no cure for autoimmune disorder. And then somebody will tell you, why don't you try homeopathy? Gives good results. Just try. Just try. Won't say it will cure. Just try. And the patients come with, sometimes they are hopeful that it will help. Sometimes they are like, I don't know, doctor, if this will work or not. But somebody said, why don't you try? So I'm trying. So we say, no worries. You try. You will see. And then they cooperate. They give history, everything. And when it starts to heal now, when I came first, I didn't think that this will help. I was just trying. But now when I am seeing the improvement that is happening, I understand that the deepest of diseases can be cured. In fact,
yes, you can if you hit the right remedy.
Yes.
Miracles can happen.
You hit the right remedy. And it is really important, like we have read in books and where even Master Hanuman has said that examining the patient sometimes in his own surroundings is really important. I remember a case of neurological complications of diabetes. Mm-hmm. My relative, where the patient is not recognizing everyone. The patient doesn't talk also. And doctors have said, give insulin injections. This is what we can do. We will maintain. But the complications will happen. Patient will go. I took history over the phone. Then I visited. I said, I'm not happy with the history. You people are taking care. But I can't give like that. I want to see. I stayed there for 2 days in their house. Wow. We are relatives now. We can stay. So I stayed there for 2 days. I observed everything. Now, then I took history of the past of the patient from the children who were already 40, 45. I asked them, how was the patient? When you were young, how was the patient? And then it told that some specific qualities of the patient was there. After that, I compiled that everything. I came down to a medicine. I gave that medicine. And I said, you keep on watching, any moment, the sugar will fall down. Be with the patient. Keep on watching. And exactly after 1 week, fortunately it was holidays. My clinic was off and I had also visited them because festival time, we all family get together. It happened. I was there. That night, the glucose levels dropped. And you know what happened? To my surprise, it was not just the glucose level that dropped. The moment the glucose levels dropped, patient recognized each and everyone that was present in that premises.
Incredible.
How? And I was like, that means the body was already balancing. We by testing did, okay, it is less, we need to give. But the body had adapted to maintain the low glucose levels to counteract the less production of insulin. And then the insulin injections were stopped. Nothing was required. No oral hypoglycemics, no injections, nothing. For 1 month, this stayed as it was. Patient didn't require anything. Thereafter, as all patients, when they are in your family, this is what they do. They did not do any follow-up with me. In spite of telling, I called and kept on asking, all is good, all is good. Then, after some time, they started with oral hypoglycemics. And fortunately, I visited, I again caught them. I said, why you people are giving? When you know how better the patient was, why are you giving? The patient was, before treatment, the patient was in such a condition, patient couldn't go and take a bath. They needed a caretaker to lift the patient, to move the patient. And all this had improved. So don't you like the improvement in the patient? Why are you doing this? Then I again went. I again gave the dose. Thereafter, for some time, Patient was all right. Then again repeated. So after a few months, patient was all good. Nothing was required. Patient lived well for up to a certain time, but already patient was in age and then had a peaceful death. No complications, no neurological complications. Till the last moment, patient was able to recognize the family members, talk with them, correlate to the past and present events. I could experiment this because it was in my family. To an outsider, I will not say you try diabetes without having any experience. But to my family members, I have my right to say, why don't you try this? And then we understand that how it can work in such diseases also. When we say that diabetes is a metabolic disorder, there is no cure. We can only maintain the level of the patient till the complications set in. And then once the complications set in, we are helpless. We cannot do anything. We just have to see the patient deteriorate. And when we see such cases with homeopathy, that we can bring that back. It's amazing. It's amazing. Like, I don't even have words to tell how I felt when that happened. But yes, I was expecting that this drop should come. And it took 1 week, So this also helps us to understand the primary and secondary action of the medicine. When the medicine was given, single dose, for 1 week, something was going on. And at the end of 1 week, we saw the end product. Now your glucose levels have come down without taking any. Patient was already on daily 2 injections, morning and evening. And after that evening injection, everything just suddenly it all went down. And we all were like, now what we have to do? I said, wait, let me see. I said, first you test. They were carrying glycometer everywhere. So they could test the glucose levels of the patient. They said glucose level. I said nothing. Give some glucose. Wait. And let's see. This should be the effect of the medicine which has been given. Wait. This was times when I was using 1 mg. After this experience, I mostly shifted to LMs because in LMs it is easier. We see amelioration directly. 1M will take time to react. The body will come to that level and then it will come. With LM, it goes on. That's how our practice also changes. And sometimes I wonder that if the 6th edition would have come up earlier, the total homeopathic scenario would have been different. Would have been really, really different.
If we would have known sooner about this, how are they called? Quinquagintamillisimal potencies.
I did not.
Thousands LM.
Yeah, quintamillisimal. Yeah. And it is amazing to understand that how till his last breath, Master Hahnemann was, continuously improvising, observing, learning, improvising to bring that natural law into application to so perfection that, everybody can, when you study it properly, when you understand it, you are able to apply. Because law of similia was known to Ayurveda, it was known to Hippocrates. We see he has stated that another way to treat is by using like cures. Like even it was known to Paracelsus, who introduced chemistry to medicine. He also understood it. But it was Hahnemann who actually would make the law practicable. It was nature's law, it was there. It is as old as the nature is. Nobody can deny that. But to practice something, put it into application, it's a big task. It is like everybody was seeing the apple falls. Newton also saw apple fell. But he thought, why did it fall and it didn't go? Now, after that, why? To go through all that process and find out why. That is what solves the problem. So it's like Now we are there, and as fortunately the basic sciences have developed much. Sometimes I wonder how can, if we compare that homeopathic medicines have so diluted and dynamized. So dynamization is energy. Dynamic word itself represents energy. So in that time when there was no E is equal to mc square, Einstein's formula, still Master Hahnemann could observe. If we read his books, we see where he writes a probable explanation where he says that when you rub two flints, the sparks come out. So the fire is already inside. When you give that friction, it comes out. So that directly, if we can relate it today in the reverse scenario, we can relate it to E is equal to mc squared, that the matter has energy and energy has matter. Nothing is without energy. Energy permeates everything.
Yes, it finally comes down to quantum physics.
Yes. And it is good that the basic sciences have developed so much that soon, I think soon everything will be sorted out. It is not a homeopath's responsibility though, but the way we understand, they cannot understand. So it has to be a collaborative effort where everybody puts their part of the knowledge. Again, the holism will come where you add all the science, not just biology. You add chemistry, physics, bio, mathematics, everything. Because you cannot understand one part in its completeness till you put it in its fullness. It's like you understand a neuron, but how the neuron works when it is in the brain.
It's different.
You cannot pick that one neuron and say this is how it works in the brain. No, in the brain it works differently because there are many possibilities, there are many pros and cons, how, what, when, where, why, so many things it goes through. If you have to understand the function of particular neuron in the particular part of the brain, you have to understand it as a whole, the brain as a whole, like we understand the human as a whole. So ultimately it all comes to holism.
And there always has been the fight between the linear thinking people and the holistic thinking people, but finally yes. I think that we will find understanding.
Yes, because see, as I said, that the nonlinear dynamics, which is the theory of complexity, has entered the field of medicine. Because I remember one saying that says that complexity is the question that affects biology the most in present scenario. Mm-hmm. Okay, and to solve this complexity, obviously they have to bring everything together. You cannot solve the complex because humans are also natural. Nature has made us, we are like ecosystems, forest ecosystems, organizations where everything is interdependent. You cannot remove the kidney and say, if kidney is affected, liver will not have anything.
No, it's impossible.
Not possible because each system is interdependent on other systems to function properly. So to understand, you have to put everything together. You have to take your psychology, you have to take your neurons, you have to take your immunity, you have to take the chemicals which, arise in your body. And this is good because we even see from genetics, we have come to epigenetics where we are trying to understand. It's obviously this, what I'm going to share is not in the field of biology. It is in the field of artificial intelligence, where just this May of this year, mm-hmm. an article has come of the study which is published, which tells us that 7 properties of brain, and you cannot say which one is chosen. It's like a computer. You have your binary coding inside. Which switch will fall off when and which switch will start and which loop to go. They are studying that now. Mm-hmm. So ultimately it's good that all these theories are coming into the field of medicine because the better they understand the disease with at least their one eye, where they understand that now the disease is a dynamic process, then we can tell them that now understand our eye. One eye is yours, where you understand that disease is dynamic process, but to see the world you need 2 eyes. The other eye is ours in homeopathy, where we say that because disease is dynamic, medicinal substances should be dynamic too. Now, when you understand this dynamic, you understand this dynamic also. And then let's collaborate both the dynamics. So we will have the whole dynamic of humanity.
I hope we will see it still in my lifetime.
Hope so.
Yeah, I really hope so.
Yeah.
So
because I feel like it is like, it's long since it has not been recognized. And sometimes when we go across all these newses where we see here that is happening, here that is happening. In fact, the last news that I went through was in Germany, where your health minister said that let the system be at it as it is. There's no need to remove homeopathy from the system. Let the system be as it is. So I see all this and I wonder that when will be the time ripe to see that homeopathy receives the respect it deserves. It is one of those things which, in proper hands, when utilized properly, it can do so much good for humanity. It can alleviate the sufferings of humanity. It can reduce it completely.
yeah,
Because nowadays, when we see diseases, how the newborns are being born, there are n number of diseases, and you don't know how that happens. Even they don't know how it happens. The diseases are, when the child is born, he comes up with diseases. That is the state we have reached. So how far till we will realize that we need to stop this suffering? Because when we treat with homeopathy, we see that overall state of health improves. The one who is falling frequently ill will not fall ill, even though he's in the same surroundings.
yeah, even me, I was prone to accident. I don't know how many accidents I survived till I met homeopathy, and finally the tendency to have accident was cured. How would you do that with conventional medicine? No way.
I have had a case of lascivious mania in India, where they brought him. They said he is a psychological case, and psychiatrists have given him all types of medicine, but it doesn't help. I said, what he does? They told me the history. I gave him the simillimum as per the totality and repertorization and everything. And then I said, you once bring him. I want to see him. They brought him. And then I had a small conversation. And then I gave him the medicine. And then one day, as the patient's mother was passing by, he was a young boy. She said, Doctor, now he is fine. Now he takes interest in the normal life. Now he is like all normal youngsters. I said, good to know. I am happy. Because when I see that I have been able to do something good for you and it has helped you, it makes me feel happy also. It leaves me with that joy where I feel that my life is utilized. My purpose on this earth, the reason I have been born into this humanness with, and why I was, why destiny threw me towards homeopathy and how homeopathy happened to me. If I don't see those results, if I don't put that much of effort from my end, it is useless. Because ultimately, what we earn in our hearts is what goes with us. Rest all material stay in the world. Nobody can take anything.
No.
Only what you have done, what you have felt, what you have spread, that is what you take with you. Be it joy, happiness,
or suffering.
Liberty, which people feel that finally I'm free from my disease. I have suffered so many years and now, doctor, I'm free. I remember a female who had a small nodule in the breast, and she had come and asked me, and I said, we will see. I gave her the treatment. Next year when she came, she was all right. She started to touch my feet. I said, don't do this. I am not God. I am just a vehicle. God wanted you to be fine. Through me, you are fine. Don't give me that respect which I cannot handle. I am a human. Let me be human. I understand how much your life would have changed by the cure you experienced. But that is good for you. Don't give me any place anywhere. I am just a human as you are. You do your work, I am doing my work. My work is to see that I can reduce as much suffering as possible in people surrounding me by guiding them that this can help you. This is how where your answer is. This is where you should look to. And when they get to that, that is it. Doesn't matter if it is me as a homeopath or anybody as a homeopath. When you go to homeopathy, you get your answer. You get your solution. And that is enough. Even if I am not the part of the process, I am happy. Why? Because somewhere homeopathy has done. Homeopathy is something, I do not have words to tell this, but when it works, it creates wonders to such an extent that I understand the dilemma what people have. I'll just share you quickly with you. It is like a patient who is suffering from renal disorders, skin disorders, hypertension, and hair loss. 4 different diseases. How you give one remedy?
Yeah.
It is a question, which bothers so many people. But to homeopath, it is very simple. That patient, irrespective of n number of diseases he presented with, it was the patient who was suffering. And the medicine we give to the patient, not to the diseases. If we have to give medicine to the diseases, we will be doing polypharmacy. But no, we do monopharmacy because we give one single medicine because we see the one single individual who is suffering from all this number of diseases. It is not 10 diseases or 4 diseases. It is the person who is suffering these 4 diseases.
And it's only a career of diseases mostly.
Yeah.
Career of the disease in different symptoms, different layers.
Yes. And it's wonderful when we get exact history, sometimes, as you have mentioned, layers. When we get history, in some patients, we see evolution of single medicine, and in others, we see layers of remedies. And when a patient and doctor both are able to take a good history, you can really tell that this patient will require this, then this, then this, then this, and that would be the end of the problem. That beautifully, you can see each level. Sometimes it is of different medicines that patient will require, and sometimes it is one single medicine which has evolved right from the first disturbance to the last disturbance. Sometimes it is one single medicine, but we can see how the disease has progressed, how initially the patient had say allergies and then went to asthma, and then after that how the patient has now developed joint pains, but it is still the same patient. And after that, when those joint pains are not taken care of, we see how the patient develops psychological disorder, like considering I am superior or I am pure and I should not touch these people and God has sent me here. So we see how the disease that was in the least important part has gone to the psyche. Look, it went from outside to inside. And we can see that this all through was just one remedy. And now when the disease has reached to the mind, we are able to get lots of mental symptoms that fit in that remedy. Now patient is presenting with mental symptoms, lots of mental symptoms. And then when we give that remedy, the mental symptoms goes away, the joint pains comes, the joint pains goes away, and the asthma comes, the asthma goes away. Then comes the allergy which was initially there, which patients say, I had years back, I don't even remember when I had it. And that allergy then goes away, and then the patient is all free. So, how wonderfully everything, step by step it goes back. It's like sometimes we feel, how can someone guess at how this happened? But we know that it is not guessing. It is pure experimentation and observation, even analyzing whether it is proper or not. To the minutest detail, it is analyzed. Yeah. Somebody will say, who is not a homeopath can say, doctor guessed it well. But a homeopath knows that it is no guesswork. It is hard work. of people who have discovered and kept on, persevering to keep the science on and on through 200 years, so that people even after that will learn, will keep on utilizing it for the better.
And still they have to learn themselves and be fit in materia medica and the repertorization. And that is not easy to do, as we all know.
Yes. There's a lot. As new and new medicines get proved, there's a lot of volume. But there's one more problem which I see emerging in India, when the combination of medicines, homeopathic medicines, have started to be on over the counter, which is not. Nobody should take homeopathy without the homeopathy.
Yeah, not without proper
Without
prescription, because it will end up improving.
Yes, yes.
And because can be very bad, as we know with lachesis.
Yes,
very,
yes.
very bad.
Yes, Dr. Herring could not wear the tie all the rest of the life he lived. He couldn't wear the tie after proving lachesis. Yes, we remember how that symptom got stuck to his constitution and saw the grave together with him. Yes.
So, my dear colleague, thank you very much for the interview.
It was a pleasure. If something of it, is of use, it can change the perception, the way we see the world, the way world sees us. That is what we aim to. It is. We are open. You want to do. You want to prove this. You want to prove that. You do. We are open.
Yes, and I think it's very important that people in Europe see how you Indian doctors work and what is your daily thing to do. And I wish that there would be more collaboration between the European homeopaths and the Indian homeopaths. And I know that we still miss a lot of homeopaths in Africa. Lots of children wouldn't be suffering that way if we would have homeopaths over there.
Yes. And with Indian scenario, what is important is because of this regularization, we get exposed to variety of diseases. We are not restricted to treat X disease and not treat X disease. We get exposed to variety of diseases. We see all kinds of diseases, from skin to internal to metabolic disorders to autoimmune disorders, everything. So that also helps us to see a different level of homeopathy, how it is used in such scenarios.
Yes, and you have a lot of experience according to that.
Yeah. So that only emphasizes more and more of our enthusiasm towards homeopathy. It keeps us going, through the day, every day, because one thing that we have learned is that every patient, no matter what is the name of the disease, is a new individual. And you don't know which window will open when, and when you will get an insight to the core of the patient, when you will know, wow, this is the patient.
This is it.
So it is not the boring routine job where you say fever is equal to paracetamol. It is always intriguing, developing us also, how to elicit what kind of patient. It's like an ever-changing, ever-learning process. And you are never like, yes, now I have learned homeopathy. No, you will always feel something is still there which I have to learn. Still there is something which every new case, you are like, this.
Yeah, it's a never-ending adventure.
Yes, never-ending adventure, correct.
Okay, Twara, it was very nice talking to you, and I hope you stay well. And let's say till next time.
Sure. Take care.
Thank you very much, and bye.
Bye. I'm obliged.